of Scalp Acupuncture, and our group consisted of myself, Allison Inlows, Betty Gong, Jolie Law, Alyssa Jung, and Melissa Finger. And I'm going to be getting us started by talking about the background of our study. So strokes are one of the leading causes of death in the US. However, due to advancements in healthcare, more people are surviving strokes. And because of this, there is more research being done about the positive effects of stroke rehab on quality of life. In China, scalp acupuncture, or SA, is a common treatment for stroke rehab. However, more research is needed on the efficacy of SA in the United States as an adjunct to traditional stroke rehab, which consists of OT, PT, and SLP. So further research on this subject would better inform OT practitioners as to whether or not we can recommend SA to our clients. And next, Betty will be talking about the purpose of our study.
Thank you, Allison. So the purpose of the study was to examine the effects of SA on the functional outcomes and length of stay for patients in an inpatient rehabilitation facility after having sustained a stroke. This was a retrospective cohort study that looked at the archive data from Good Samaritan Hospital of 160 patients from January 2018 to September of 2019. And 80 of these patients received 3 or more SA treatment sessions and traditional rehab services, which we'll refer to them as the SA group, while the other 80 patients only received traditional rehab services, which we'll refer to them as the non-scalp acupuncture or the NSA group. All SA sessions were provided by one acupuncturist, James Liu. For data analysis, the FIM scores between these two groups were compared to analyze the functional improvements. SPSS was used to perform statistical analysis, and this was to determine significant differences among mean FIM change scores, which is a difference in FIM scores from admission to discharge, and the length of stay between patients in both the SA and the NSA group. Next, Jolie will talk about the results from this study.
Thank you, Betty. So when looking at the FIM score results, paired sample t-tests were conducted for each of the SA and NSA group to examine if there were significant improvements in the FIM scores from admission to discharge. Both groups showed statistically significant improvements, and the percentage of patients who met their FIM goals at discharge was the same in both groups. However, when compared to the NSA group, the SA group showed statistically significantly more improvement in certain domains, as the highlighting in Table 1 shows. Examples of some of these domains include eating, bathing, grooming, and dressing. And due to multiple comparisons, we use Bonferroni's adjustment to control for type 1 error. This is shown in eating, grooming, and memory, as noted by the blue box in Table 1. In addition, when controlling for age and length of stay, no significant difference was found among the mean FIM change scores between the SA and NSA groups. In looking at the length of stay results, Table 2 shows the results of the independent t-tests that were conducted to analyze the difference between the mean length of stay treatment time and OT minutes between the SA and NSA groups. The SA group had a significantly longer length of stay by 6.65 days than the NSA group. Therefore, the OT treatment time and total treatment time for the SA group was also significantly longer than the NSA group. Next, Alyssa will discuss what these results mean for our study.
Thanks, Jolie. So first, many of the FIM domains that displayed greater improvements in mean FIM change score in the SA group when compared to the NSA group are within the OT scope of practice, which means SA may provide supplemental support in reaching functional improvements and occupational therapy goals in these domains, which encourages OTs to actually consider SA as an adjunctive service. Next, when we analyzed the NSA group alone, we found statistically significant improvements in the FIM scores from admission to discharge, which affirms the efficacy of traditional rehab services, which includes OT, PT, and SLP. It's worth noting that we actually took another step to control for age and length of stay, because as seen in the results, The SA group consisted of a younger population that had a longer length of stay, which was interesting. And so through the Mancova test, an analysis suggested that SA combined with age and LOS, which is length of stay, both which were confounding variables, impacted functional improvements. This will help guide practitioners to consider age and length of stay when providing or referring patients to receive SA. And furthermore, age as a confounding variable was supported by previous research, which demonstrated that younger patients have better functional outcomes when compared to older patients in rehabilitation. And previous research also supported our finding of length of stay as a confounding variable. In addition, hospital protocol at the Good Samaritan Hospital included increasing a patient's length of stay when they recognized an increased potential for functional improvements. And next, we're going to have Melissa share about our implications.
Thank you, Alyssa. So to wrap everything up, as Alyssa mentioned, we want to encourage occupational therapists to consider scalp acupuncture as an adjunctive service when working specifically with younger clients who have sustained a stroke and that are interested in acupuncture. Especially when working with clients whose goals target eating, bathing, grooming, upper extremity dressing, and toilet transfers. So it's really important for practitioners to work closely with specialists, such as acupuncturists, to determine how their services may help clients progress towards their goals more quickly and to understand which specific clients may benefit from their services most. Finally, occupational therapists should advocate for inpatient rehabilitation facilities in which they're working to consider incorporating this type of treatment to promote greater functional improvements for their patients. And finally, we'd like to acknowledge the staff at Good Samaritan Hospital, which collected this data for us, Lisa Calloway, Clint Hopwood, and James Liu, and to Dr. Chang for guiding us through this process. And now we'll take questions. Thank you all.